Will my insurance cover my colonoscopy? Thinking about getting a colonoscopy but wondering if your insurance will help cover it? Let's break down what you need to know. Most health insurance plans, including those under the Affordable Care Act, typically cover screening colonoscopies starting at age 45. This means if you are at average risk for colorectal cancer, your insurance usually pays for the procedure entirely, with no out-of-pocket costs like copays or deductibles. But it's important to understand the difference between screening and diagnostic colonoscopies. A screening colonoscopy is done to check for cancer or precancerous polyps in people without symptoms. If the doctor finds polyps and removes them or takes a biopsy during the screening, the procedure might be reclassified as diagnostic. In that case, you could be responsible for some costs, such as coinsurance or copays. If you have a family history of colorectal cancer or other risk factors, your doctor might recommend earlier or more frequent screenings. Insurance coverage for these higher-risk cases can vary, so it's a good idea to check with your insurer. Medicare, for example, covers screening colonoscopies every 10 years for people at average risk, and more often for those at higher risk. However, if polyps are removed during the procedure, Medicare usually requires a 20% coinsurance payment for that part. If you have a positive result from a stool-based test like a fecal occult blood test or stool DNA test, Medicare and many private insurers will cover a follow-up colonoscopy without extra costs. Keep in mind that coverage can differ depending on your insurance plan, especially with Medicaid or Medicare Advantage plans, which might have different rules or requiring prior authorization. To sum up, if you are an adult aged 45 or older at average risk, your insurance is very likely to cover a screening colonoscopy fully. If you are at higher risk, or if during the procedure polyps are removed or biopsied, some costs might apply. Always verify your coverage details directly with your insurance provider before scheduling your procedure. It's also helpful to discuss your personal risk factors with your healthcare professional to ensure you get the right screening at the right time. Remember, staying informed and proactive about your health can make a big difference in preventing colorectal cancer.